Good morning to everyone. I'm Giuliani Thomas, tutor, Tripura College of Nursing. In this video, I'm going to teach you about contraction stress test. It's also called as oxytocin challenge test. The objectives of these topics are introduction, reason for CST, idea about CST, step of the procedure, interpretation of CST, contraindication and summary. In this video, I am going to deal about this all. The contraction stress test CST. It is performed near the end of pregnancy to determine how the baby might cope up with contraction during labor or childbirth. The aim is to induce contraction and monitor the fetus to check for the heart rate abnormalities using a cardiotocograph. The CST, it is also called as oxytocin challenge test and pregnancy stress test. These all are the different name of this test. It is first introduced by Ray in 1972 and later in 1975 Freeman, he is the one introduced the parameters of contraction number and frequency to standardize this test. What all are the reasons for contraction stress test? If the mother is having any high risk pregnancy, there the doctor will tell the mother to do CST. And if the patient is having gestational diabetes mellitus and she had any complication in their previous pregnancy and pregnancy has gone up to 40 weeks. These all are some of the conditions there the doctor will encourage the mother to do CST. It is very important because after the test, they can know about the baby can cope up or not. What is the idea of this test? It is a uteroplacental unit, and if the fetal oxygenation is marginal at rest, it will transiently worsen with uterine contractions. If there is any late deceleration, then we can know that there is hypoxemia. If the variable deceleration were seen, we can suspect there is oligohydramnion. The steps of the procedure. After the mother comes to the procedure room, we will allow or we will encourage mother to lie on her left side, left lateral position. And the technician straps two devices in her belly. One will monitor the baby's heartbeat The other will record the contractions in her uterus. The machine records the contractions and baby's heartbeat in two separate lines on the graph paper. And we will monitor for about 20 minutes to make sure the baby is okay or not. We'll give a small dose of synthetic oxytocin, that is pitocin, in an IV to stimulate contraction. Otherwise, we can stimulate the mother's nipple, then the natural oxytocin will release. But this is not as easily controlled as the medication. The contraction test lasts until the mother had 3 contractions in 10 minutes period, each lasting 40 to 60 seconds. This we can take up to 2 hours. The mother may barely feel the contractions, or they may feel a bit like menstrual cramp. They should not be strong enough to induce labor. When the test is over, mother need to stick around until the contractions stop or go back to their pre-test level. These are the steps of this procedure. How to interpret? After taking this CST, we will get the graph paper, and if there is no deceleration with the 3 contraction in 10 minutes, then the test is negative. And if it is positive, there is late deceleration with 50% or more of the contractions. And there is intermittent late deceleration or severe variable deceleration, that is suspicious. If it is less than 3 contractions or hyperstimulation, then the test is unsatisfactory. These are the interpretation of the CST. Here in this graph you can see a non-reactive NST followed by CST. This is a negative CST graph. In this graph, the first one is negative. There we cannot see any deceleration. But in the second graph, it is positive. Here you can see 2 transient deceleration. So it is positive. What all are the relative contraindications of this procedure? If the mother is having preterm labor, or certain patients at high risk of preterm labor, premature rupture of membrane, history of extensive uterine surgery or classical cesarean delivery previously, and non-placenta previa. These all are the conditions, contraindication for CST. The role of this technique. The role of this technique has yet to be established, It has been associated with reports of fetal death in case of unrecognized severe fetal compromises. So the CST is very important during the pregnancy, high risk pregnancies. So in this video, we dealt with what is CST, what all are the reasons we will do CST, interpretation of CST, contraindications of CST. This test helps to predict how your baby will do during labor, and the test triggers contraction and registers how your baby's heart reacts. A normal heartbeat is good sign that your baby will be healthy during labor. These are the references for this video. Thank you all.